Building.
Hey everyone, thanks for joining. Hey everyone. We'll be getting started in just a second. We just want to give time for folks to get on. Want to play your meditation music on your Pandora?
It's not really on. You know hear it?
Oh, it's low.
Yeah, I was bringing it down so we can turn it up later.
I think a little background music won't hurt.
It was just low. It just was.
I can hear it now.
Yeah.
We're talking about grief and healing today, guys. I know a lot of people are going through things with COVID, with loss of jobs, family members, relationships, pets.
Yes.
So we definitely wanted to bring something to you all that can serve as valuable information during a time where people have lost so many things. So we really do hope that you all will get something out of this session. And we'll be doing these periodically, and we'll be doing different sessions. If you don't mind, if you could type in the chat what types of topics you would like us to discuss in future therapy minutes. Again, today's session is on grief and healing. So just type in the chat what types of topics you would like us to discuss in future sessions so that we can take note of them. And this is a safe space, so don't be shy with your responses. Surprised people didn't come over from your live.
And it's public. So I don't know.
Mine is public.
Yeah. I don't understand. Or maybe I have that. But it's also delayed.
You want to get started?
Yeah. You can wait.
You want to wait a couple minutes?
Yes.
All right, guys. So we'll wait just about 2 more minutes. So don't leave. Stick around. Oh, thank you. Lovely wall. So while you're typing in the chat, please jot down what are some topics you would like us to discuss in future therapy minutes. So it can be anything from anxiety, financial literacy, depression, any topic. Nothing is off limits. Setting healthy boundaries, whatever topics are of interest to you, go ahead and jot them in the chat so that we can take note of them.
Let me also see. Maybe I could do this one. But I don't know if that means that I'm not going to be able to see my notes. I really like them.
Yeah, we need your notes.
I surely do.
We do. That's important.
It is. And I don't know that you can do both.
All right, guys, we're going to start in 1 minute. Hey!
And you can't do both. But I can say, come on over.
All right, I see a few topics. Financial literacy and healthy boundaries. An expert to discuss vaccinations. Okay, we can certainly work on those. So for those of you who are just joining, folks are writing in the chat what types of topics you all would like us to discuss in future therapy minutes so that we can make sure that our therapy minutes are crafted to, things that are of interest to you.
Okay, we're going to get started. Oh, good. Women in healthcare during the pandemic. That's a good topic.
Very good.
Very good.
Yeah, it is. And so we'll definitely be taking note of these things and crafting our future therapy minutes around these topics so that we can make sure we're bringing information that's valuable to you all. So thank you for joining us. We're going to go ahead and get started. I'm Kristen, owner of K Restoration Wellness Salon.
And I'm Samantha Leach of Flint LLC.
And so today we're going to be having a conversation about grief and healing. That's our topic. And so we'll be sharing some slides with you. Don't feel like you have to write them down. We'll post them to our pages later so that you can have access to them and share them with your networks or anyone that you feel may benefit from this topic. So just going to get started with a quick definition of grief, which is deep sorrow caused by loss. And we really wanted to highlight a lot of people when they think about loss and they think about grief, they automatically associate it with death. right? But there are so many types of losses. It can be the loss of a relationship, like a divorce. It can be the loss of a home. It can be the loss of a job. I know that during the pandemic, many people were laid off from their jobs. Many people lost their homes. So all of those types of losses can absolutely trigger grief. So we definitely want you guys to be aware of that. I was speaking to a woman on yesterday, and she was sharing with me some things that were personal to her. And we had a conversation about the fact that she was experiencing grief because she and a family member are no longer as connected as they once were, right? And so she's dealing with the loss of that relationship as it previously was. So just keep in mind that grief can take form in many different ways. There are 5 stages of grief. And again, don't feel pressure to write them down. We'll be posting them on our pages. But the 5 stages of grief are denial, anger, bargaining, depression, and acceptance. And it's important to note that these different stages of grief, you can cycle through them at any given time. They're not linear, which means that you may experience depression before you actually experience anger, or you may experience anger multiple times throughout the grief cycle. So it's really important to be mindful of the fact that these stages of grief really do cycle and spiral. And so if you notice that you're experiencing grief, do be mindful of these stages so that you can identify which stage you're currently experiencing, which will ultimately help you with your healing. Okay. I'm going to turn it over to Sam, and she's going to discuss just a few ways that grief can actually manifest and show up in your day-to-day life.
Thank you, Chris. So for those of us who have dealt with any kind of grief, we know that it manifests itself in many ways. We're going to highlight 4 of those ways, and we can deal with some of the others later. But the 4 that we chose for today is promiscuity, self-harm, overindulgence, and physical illness. So for promiscuity, I'll say that for many dealing with grief, your sex drive may decrease. However, for others, it can increase significantly because of the need to numb grief by having something that feels good to you. It's also affirming at a time when coping with death has become a part of one's, daily life. So if there's a loss of a partner or spouse, you may be missing the sexual and physical intimacy that you once shared with that person. Additionally, our organs release oxytocin, which is the bonding hormone, and endorphins, the feel-good hormone, which also reduces the perception of pain. And in self-harm, which is non-suicidal self-injury, it's like the act of deliberately harming yourself, like the surface of your own body, or cutting, burning, using cigarettes to burn yourself, and other things, hot wax. People have been seen to do that, and also punching walls. This is usually the result of a person's inability to cope in healthy ways with psychological pain. And
so can I ask a quick question?
Sure.
I'm sorry. Does that manifest in, aggression?
Yes. So that's why if somebody hits a wall, they're not necessarily harming anybody. They may have to get it repaired, but they're harming themselves because the pain that they're feeling is they want to feel less of the pain that they're feeling emotionally. So you're punching a wall, and this pain is sort of like, it makes it present. Like I'm hurting myself at that moment, to numb some of the other things that you would be feeling emotionally.
Gotcha. But in terms of, I'm kind of wondering, because I know some people, self-harm is certainly one of the ways that grief shows up. But what about harm toward others as well? Is that something that,
Yeah, I think for sure that when we hurt, the term hurt people. So people who are violent, may become more violent towards others if that's sort of in their nature. But people who self-harm were not necessarily always that way. You can develop the act of self-injury through grief, and loss. So that's something. But again, that is something that we experience when you have difficulties with regulating and expressing oneself. The overindulgence that we speak of is like overspending, overeating, gambling in excess, and even giving too much to others of yourself, over nurturing other people so that you don't have to deal with the pain of the loss that you've experienced.
So it's almost like deflecting from what's really going on,
Yes.
and trying to kind of cope with that by way of throwing yourself at other things or other people, helping other people.
Yes, and so in essence, you're not able to deal with your own stuff. You don't even have time because and I feel like I've done that, a lot. And in physical illness, the heartbreak of grief can increase blood pressure, and it can cause a risk of blood clots. Intense grief can alter the heart muscle so much that it can cause broken heart syndrome, which is a form of heart disease with the same symptoms of a heart attack.
So broken heart syndrome is like a real thing.
It is the actual thing.
Okay.
And like I said before, it has the same symptoms of a heart attack. And stress is what links the emotional and physical aspects of grief.
Mm-hmm.
Of grief, I'm sorry.
Mm-hmm. Mm-hmm. And I think that's important because I think sometimes people are like, oh, I'm sick. I don't feel well. I have a headache, or I just feel down. I feel stressed. I feel, they're having physical symptoms in their body, not realizing that there's a connection between their grieving
Yes.
and the physical illness that they are experiencing.
And we also know sort of like what we feel when we get anxious or we get anxiety. And you started to feel like, oh, I need to pull over. I feel like I'm about to have a panic attack. Like you're physiologically changing.
Yeah. And that's a whole nother, and I hear people saying, yep, I see people comment in the chat, guys, if you guys are, have thoughts about what we're sharing, if you can relate to what we're sharing, we want you guys to engage. So definitely comment in the chat so that we can touch on the points that really resonate with you.
Yeah. So, going back to that, when we experience feelings of anxiety and panic, because usually the anxiety leads to the panic, we'll say, oh my God, I need to stop for a minute, or you feel all of these physiological changes, like you sweat or
I'm a sweater. And if you know me, I'm a sweater, like literally. So I don't like going live. I don't like, this kind of thing. And so Sam will tell you my whole back is soaking wet with sweat. But that is the physiological symptom of my anxiety.
Right.
Exactly. And so it really is important to pay attention to how your body is responding, because your body will absolutely tell you when something is wrong. And sometimes you may not even connect the dots, but if you have this information and if you're not armed with this knowledge, you are better able to, be able to recognize kind of what's going on with you and what you're experiencing.
Or for some of the things that you do. So I'm doing this stuff kind of purposely. So I might do this.
She's fidgety.
I might be moving, right? Because I'm in the moment, letting you see that this is sometimes what we do when we're anxious and we're nervous or we're feeling some of these emotions, and then the physiological changes then occur. And so like if you're in pain, if you're grieving and you don't have an outlet or you don't know how to cope with it, because now we're trying to talk about coping skills and tools for better coping, right? So if you don't have that and the thing that normally comes up for you is to retreat to your room, stay in your bed,
the promiscuity piece,
right,
the overindulgence.
Yes.
And those of you who know, I suffered with depression really bad for years.
Right.
And so I had all of these symptoms and I was grieving, right? The promiscuity was big for me. Someone said that they're going through this now since the passing of their mom. And so first of all, condolences to you and your family. Secondly, thank you for being vulnerable and feeling comfortable enough to share in this space. We appreciate that, and we certainly want to give information that supports you. And stay to the end because we're going to talk about tips to manage, grief. So definitely stay to the end. We're just reading some of the comments. Very true. The body will tell.
Having
issues with my face and never thought about it until now. Stress. Absolutely. So it's your body is purging. So everything that we take in, even on a psychological level, it always has to come out, right? And so, and it happens to me as well. When you have this breakout here, especially for women in this bottom half of your face, it can be stress and anxiety and hormonal, right? And so your hormones fluctuate when your body is experiencing stress and grief. And for those of you who are just joining us, we'll be posting this slide deck on our page. So you'll have access to see the content that we've discussed today. How do you reduce anxiety or stress? What are coping examples? We're about to get into that right now.
Yes.
And so to that point, there are a few quick pieces that we want to highlight, and there are many more. And of course, this is a continued conversation.
Right.
But just for starters, we wanted to give you all some quick, actionable things that you can implement to help you manage the grief that you may be feeling. So the first thing, which it sounds easy, but I find that it's one of the hardest things to do, is to acknowledge your pain.
Yes.
Sam's a mom, so she has children, she's busy, she's moving around, and so sometimes I'm sure when we lead busy lives, it's hard for us to kind of even stop and acknowledge that there's something wrong, there's something going on.
And not only just the acknowledgement of it, but sometimes you don't want to acknowledge it because then that means you have to deal with it. But if you don't deal, you don't heal, right? And we have to face it in order to fix it. The thing is that when you have other responsibilities, when you're starting a new business, when you are launching and you feel like I got to be on 100% of the time, we don't realize that being on doesn't necessarily help us if the people that we're trying to feed this information to are getting all of the goods, but we're suffering in silence, right? And so you have to have somebody, right, that you can, and she's going to touch on that in a second, but just have somebody that can listen to you and hear you and give you the right kind of advice. Right.
Yep. And actually this step about acknowledging your pain, it really is linked to the 5th stage of grief, which is acceptance.
Right.
And people would ask, how do I accept something that I don't like,
right,
or I don't want to be, like the passing of a loved one? Like, how do you accept that? And I think it's not about liking it, right? Accepting something and liking it are two totally different things. Accepting just means that you identify that this is the new reality. And then it's, how do I move forward from here? So keep that in mind. Just because you accept something doesn't mean it necessarily feels good, doesn't mean that you like it, doesn't mean that you are on board with it. It's simply knowing that this is your new reality and then figuring out ways to adapt to that new reality. Keisha says, I just want to be by myself now, and I realize that this isn't normal and I needed someone to talk to. 1000%, that's isolation. Yeah. So that's another way that grief can manifest and show up. When we went through the slides, I'm gonna go back 1 second. When we went through these 4 slides, 4 ways that grief can manifest that Sam talked about, you probably heard Sam mention these are just 4. There are many ways that grief can show up. Yes. Another way that grief can show up is by isolating.
Yes.
Right? And Keisha, you're not alone. There are many people. I was one of them. Didn't want to leave my room, didn't want to come. I mean, she'll tell you.
Yes.
Go nowhere, okay? And what you will find when you isolate like that, your mind, you begin to ruminate on things. So you think about it all day. It's like your mind just will not turn off. It really is not healthy. It is so much more healthy to do step 2, find support groups. And even if you don't find a support group, find people that can give you wise counsel, right? That's so important. Sometimes we just want to run and talk to our girlfriends, which is cool, but not always healthy, right? Because your girlfriends may not give you the most appropriate advice. So you want to seek out people who can give you wise counsel, who can pour into you, who can give you information that's going to help push you forward. K Restoration will be hosting grief support groups starting in September. And we do have a licensed clinician leading those groups. And again, they'll start in September. They'll run for 6 months. So definitely, I'll be posting about that in the coming months. I believe starting in June, you'll start to see information from me about the support groups, because again, there are so many people dealing with grief. We definitely want to provide the support, that folks need.
And I would also say during the time when you feel like you are isolating yourself the most, have somebody that's willing to come and get you. It's not everybody that you would open up that way to, but you have to say to somebody, if I get to this place, if you don't see me for 3 days, if whatever your limit is, if you don't see me for 24 hours, come and get me. Because if people know your pattern, you got some people that just isolate in general, like that's just a part of their personality. But if you're the type of person that normally will call your girlfriends and say, let's hang out, let's go to the bar, let's go to the store, to the mall, whatever, and you stop doing that, somebody has to be tapped in enough to say, no, I'm coming to get you out the bed. We need that type of support. And it's usually the hardest people to usually get through to are the people who are always out there for everybody else. Because everybody assumes that those people are okay, right? People who are always doing for others, they never need anybody based on other people's opinion, but that's not necessarily true. So reach out to your friends, reach out to your family if you're that person, because you have to be that trusted person. So you have to show up trustworthy, but also get yourself somebody that will show up in that way for you. I love you too.
And I see a few people. Yes, Carmen, I will definitely be saving this live. And then I'll also be posting the slides that you see on the screen, so that you guys can keep them, you can save them, you can share them with your networks. We want to get this type of therapeutic information out to as many people as possible. So if you're on this live, please share the content so that we can reach as many people as we can. And then lastly, because I'm sure we're way over time.
Right.
We don't want our therapy minutes to turn into a therapy hour. But the last tip that we have in terms of managing grief, be kind to and patient with yourself.
Yes.
And I think that is so important, because we can be so critical of ourselves. We can beat ourselves up. I've been in the anger phase for so long. I need to get over it. Everybody's grief process looks different.
Yes.
While there are 5 stages of grief, everybody cycles through those stages at different times, at different rates. So it's really important to just be kind with yourself. And it's really important to be patient with yourself, because your process may take a little longer than the next, because we're all just different, and uniquely different. Give yourself grace. Somebody said that. Yes, she came to win. Give yourself grace. That is so important, because we give grace to others sometimes, but we kind of neglect to give it to ourselves.
The other thing is, don't allow anybody else to rush
your process.
Yes. Whatever your
process. You should be over this by now.
Yes.
You should be. No, sis, I'm not over it.
I'm not over it. And it's going to take me some time. And it's not your loss, it's mine. And also,
that's a good point.
Yes.
That's a hashtag.
Yes.
It's not your loss, it's mine.
Yes.
Somebody hashtag that.
That is the hashtag.
I feel like that's a word.
Yes, it is.
Because people want to rush your process.
Yes.
And
it's not for them to do. And I was in a grief group yesterday, and I saw so many people post, what do you do when people are telling you that you should be over it? I'm just like, wow, you don't even think about the fact that people can be that cruel, that they're asking you, when are you going to be over this, or telling you that you should be,
I see a really good one here. I thought I was fine, but was triggered and cycled back, which was okay. It's absolutely okay.
Yes.
We just talked about that a little earlier. These are the 5 stages of grief. They cycle. Just because you've already experienced the anger phase does not mean that you will not experience it again.
Right.
Everybody's process is different. So it's okay not to be okay. You might experience the depression phase a little longer than other people. Me yeah, and that's okay. So I definitely want to highlight that point. And something that's critical, guys, take this down. when you are triggered by something, that means you have not fully healed from that something, right? You are not triggered by something that you have healed from. Triggers are things that tap into a space that has not been fully resolved, okay? And Samantha has on a button that says triggered. Okay. You know, that is important to know. So it's okay that you cycle back. It's absolutely okay that you cycle back. What happens is that, you know, we have to start to do the work to peel back those layers, to uncover our truths, to walk in our truth, and to start managing our grief appropriately. Someone says, it's not your loss, it's mine, my healing. And your healing is personal.
Yes.
Right? It is personal. It is your journey. It is your story. And it is okay. We are like way out of time. So what we want to do is we want to end with a very quick meditation moment. Because I find meditation to be helpful. I know Samantha finds it to be helpful.
Yes.
I know she uses meditation often, as do I. And so we're going to just kind of put on what we find to be a kind of relaxing image. We want you guys to take just about 15 seconds with us to do some quick deep breathing. This is another tip to managing grief. Breath work is what the therapeutic term would be. When you're meditating, it's okay if you don't know how to calm your mind instantly. It kind of comes with practice. But if you focus on your breathing in through your nose, out through your mouth, that is very helpful. And if you count your breaths, that is very helpful as well to kind of still your mind. Once we end our meditation moment, we're going to be officially done with our session. If you have any, questions, feel free to type them, in the box. And we'll stick around for a couple of minutes to answer any questions that you may have. And so, I think we're going to jump into our meditation moment.
Yes. And this is just another piece of self-care.
Mm-hmm.
We want to promote self-care, and doing nothing for 15 seconds is self-care.
Yep.
So take this time for you.
If you're working, if you can just kind of pause your computer for 15 seconds. Sometimes you really need to just take a moment.
Yes.
Right?
It's your moment. So let's go.
Let's go. 15 seconds. In through your nose and out through your mouth. Ladies, I hope that deep breathing helped you. I feel like it brought me back down to calm.
Me too, yes, I'm good.
And so we are appreciative. Thank you so much for the compliments. We really, 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 my heart is for women and to help women heal. I suffered with depression for so long that I'm like a walking encyclopedia for depression. So thank you, ladies and guys, so much for joining our session. We'll stick around for a couple minutes. If you have any questions, feel free to ask them. You're welcome. You're welcome. And again, we'll be sharing this information on our pages. So check back. If you're not following K Restoration Wellness Salon, please follow our page because we'll be doing events like this. We'll be doing, we have a girl talk coming up next month, April 27th. And we do have a licensed clinical psychologist that will be joining and popping in to do some, have some conversations with us about mental health and things of that nature. So we have a lot of things in store.
And some of you posted your suggestions for future sessions.
Yes.
And so we definitely will be considering those and looking for those experts, especially for the vaccinations and how women, I think there was something about how women are managing through a pandemic. That is really important. So with that, we thank you guys for coming and showing up and for allowing us to show up in your lives too.
And for trusting us to lead this session for you all. Have an amazing rest of your week, a great weekend. And we will talk to you all later.
Next time we're going to make this a little shorter, but we did enjoy
talking with you all.
And this was the inaugural one, so we got a chance to do some of what we wanted to do.
Yeah.
But we will keep these to like 5 to 10 minutes in the future.
And send us if you have any critiques, if you have any no ladies, we're okay with it being 20 minutes. I think we're probably at about 20 minutes, 25 minutes. If you're okay with that, let us know. If you want us to keep it to 5 minutes, let us know that too. Any feedback is definitely welcome and appreciated because this is a community for you. So enjoy the rest of your day, ladies, and we will talk to you guys at our next therapy minute. Stay tuned so that you'll keep up with the updates we'll be posting.
Thank you all.